For this exercise video, we are going over breathing, bracing, and how to breathe under a brace. So with our breathing techniques, we want to start with a 360-degree breath, where we're really utilizing our diaphragm, the muscle of breathing. When you take a good deep breath in, the diaphragm and the pelvic floor relax or lengthen and then recoil back up to their original position. So when we take a good deep breath in, we should see expansion of the rib cage. We'll see a bit of chest breathing, a bit of expansion through the back, and very little to no movement of the shoulders. So if you're somebody that's taking deep breaths in and raising your shoulders, you really need to work on that 360 breathing expansion through the rib cage. So that's step one, is being able to take a really good rib breath or 360-degree breath. Next, we'll talk about the ability to appropriately brace the core, and we are talking about the lower abdominals in this situation. So if I take a good deep breath in through my rib cage, I should feel my pelvic floor lengthen or relax a bit, and then on my exhale, again, it recoils back. Now, in order to add a brace to this, I like to find my pointy hip bones in the top of my hip and then move my fingers just inside of those pointy hip bones. So this is where our lower transverse abdominals live, our lower abdominals. So if I brace my core with my fingers just inside of those pointy hip bones, I should feel a bit of tension or tightening under my fingers. So if you don't feel anything, then you might not be appropriately using your lower abdominals. What we tend to find is that people in general, typically use their upper abdominals and they push down when they brace their core, creating this lower inactivation. Sometimes folks will complain of that lower belly pooching from using their upper abs and pushing pressure downward. That's not ideal for our pelvic floor or for lower abdominal engagement. Or patients will suck the belly button down into the spine, and now we have pressure going up and we also have pressure going down. So the goal here is to think about inhaling our breath down, exhaling our breath up, and gently engaging the lower abdominals and allowing the upper abs and middle abs to help out as appropriate. So I'm going to take a good deep breath in. I'm going to exhale. As I exhale, I'm drawing my two pointy hip bones together and I'm pulling my pubic bone up slightly towards the ceiling. Now, if I inhale and I use my upper abs to push down, now my upper abs are really hard and tight. I have this lower belly pooching and I'm not engaging my lower abs at all. So again, we should inhale. Engage from the bottom up, and you'll notice that one, you don't have that lower belly pooching, and two, that your lower abs are turning on underneath your fingertips.